Well, 79 million Americans may acquire an HPV infection at some point in their life, and yet there are many misconceptions about HPV vaccines.
Here to debunk the myths is OBGYN and women's health expert, Dr. Pari. Thanks so much for joining us, Dr. Godsey.
Thank you for having me.
Well, let's talk about HPV and what is it and how is it transmitted?
So HPV is human papillomavirus, and it is a sexually transmitted virus. And there's hundreds of strains of the HPV virus, but the scary part is some of them can lead to cervical cancer and other types of cancers, and some can also lead to genital warts.
Wow. All right. Well, let's talk about the vaccine and who should be vaccinated.
So it is recommended for all girls ages 12 to 26, and then boys ages 12 to 21.
Interesting. Okay. So it is a 3-shot series. I think my daughter's got those shots.
It is, exactly.
All right, very good. Well, what about there's a myth that if you're in a monogamous relationship, you don't really need protection. Is that true?
Well, that's something I hear a lot from patients, actually. Like, oh, I have a boyfriend or I'm married, and should I still get the vaccine? And I always say, yes, definitely get the vaccine, because you don't know what the future holds, right? It's great that you're in a relationship, but you could break up, you just never know.
Yeah, and then let's talk about, say, one of your son or your daughter gets the vaccine and they get it kind of early, if you're talking about, in their early teens. Do you think it encourages sexual activity?
It definitely doesn't, and there are actually new studies that have come out looking at that because it's such a common concern. And the studies have shown that really there is no association with the vaccine and an earlier path to sexual activity.
I think that if they're going to do that, they're going to do that, right?
That's what I say.
What about the vaccines and some people thinking that there might be harmful side effects? Any side effects with the HPV vaccine?
So the HPV vaccine is similar to what we know with all vaccines in terms of side effects. There's just maybe some redness, some light burning at the injection site. Some people can get lightheaded or have a headache. And there are also sometimes people that are allergic, but there's no major side effects that we see with the HPV vaccine.
And when we were talking, so Ellen's daughters and a lot of a lot of girls have been vaccinated. Has it always been for boys as well, or is that newer?
It's newer than the girls, but it has also been around for some time. It just people aren't talking enough about it, and the guys don't have the same association as the females do because they're not going in and getting pap smears, they're not getting regular checks. But it is still very important for all boys to also be vaccinated.
And is it as prevalent as they say that a lot of people have it and don't even know it?
Yes, about 80% of the population will come in contact with the HPV virus at some point in their lifetime.
Ooh.
So a lot of times it goes away and it doesn't cause any problems, but you just don't know if you're going to be one of the people that it does cause a problem.
Yeah, so be careful. Get the pap smears and all that stuff.
Exactly.
All right. Thank you very much, Dr. Pari, for joining us.
Thanks.
And you can find out more information about Dr. Pari's and just go to her website at drpari.com. Simple as that.
Thank you.
Thank you very much.
Thanks, guys.
Really appreciate it.
Thank you.